Hello, I'm Dr. Eugene Grudnikoff, a psychiatrist, and this is the second lecture in our series on autism spectrum disorders. It's intended for parents, and in this lecture we'll discuss um, signs and symptoms of autism. We'll talk briefly about screening for autism, and we'll talk about how to understand the symptoms and how they're organized to make the diagnosis of autism spectrum disorders. Autism symptoms fall into two broad categories. The first one is deficits in social communication. And social communication and social interactions are generally things that involve child's relatedness to other people. It's important for parents to remember what we discussed in the introductory lecture, that autism is a neurodevelopmental disorder. As such, deficits happen as part of development, and that's where interventions are most effective. And that's why it's critical for parents to learn as much as they can about autism so that they can get the best possible intervention as quickly as possible. Autism is a heterogeneous disorder, which means that it can present in different ways and at different times. Some children have very subtle symptoms that are not discovered until they are in middle school or even teenagers. Other kids will have more severe symptoms that present early on in the second year of life. Sometimes children develop normally and hit a plateau. At other times they develop and then lose the developmental gains that they have made. All of these different clinical presentations can be part of autism. So let's talk a little bit about how DSM-5, the Diagnostic and Statistical Manual used in psychiatry, classifies symptoms of autism. There are two large categories. The first one is deficits in social communication, and the second one is restricted and repetitive behaviors and interests. Under social communication, the first group of symptoms is termed social reciprocity, or social and emotional reciprocity, which essentially refers to ability to engage with others, share your thoughts, feelings, and be interested in those thoughts and feelings of other people. Just like all of these symptoms, there is a range from more severe presentations that happen early in life to those that occur later. In younger kids, deficits in social reciprocity may manifest themselves as just complete lack of interest in other children. These toddlers are often described as being too quiet, just content playing by themselves, playing alone, and they also have diminished interest in talking to their parents. In somewhat older kids, the language, when it is developed, may be one-sided, which means that a child expresses their needs and wants, but is not using language to talk about feelings or emotions, their own emotions or feelings and emotions in others. More subtle examples of deficits in social reciprocity include problems like ability to join a conversation or difficulty with keeping a conversation going. These skills require this ability to imagine what the other person is interested in or what the other person may be feeling. The next category of symptoms under deficits in social communication is deficits in nonverbal communication. In younger kids, in the second year of life, this presents as this often presents as a deficit in joint attention. Joint attention is a term that means two people paying attention to the same thing at the same time. A common example is when a parent points something and says, look, airplane. And the normally developing child will follow the mother's gaze and look at what she's pointing at. This may not work for a child with autism. And joint attention is a skill that begins to develop before speech when a child is 12 to 15 months of age. It works the other way around. Children with autism also do not engage their parents' attention. They don't bring things to show to their parents. In somewhat older kids, but in toddlers too, deficits in nonverbal communication often involve lack of eye contact or abnormal eye contact or or indifferent eye contact. Looking somebody in the eyes has a very powerful communicative function. We use our eyes, our eye gaze, to convey a lot of the meaning behind what we're saying and how we're feeling. And this is kind of lost on children with autism. To them, eyes don't have that important function in communication. This should be distinguished from children who may be avoiding eye contact because they're anxious, or in children who were raised in cultures that emphasize not looking somebody in the eyes as a matter of cultural tradition and cultural standards. In older kids and adolescents, these deficits may be more subtle. For example, difficulties with using body language appropriately, your body posture, your hand gestures. Sometimes they don't match what the person is saying. They're kind of out of sync or appear odd or disjointed. And the last item under social communication is difficulty with developing relationships. And this also includes difficulty maintaining relationships and difficulty understanding different types of relationships. Little kids will, toddlers in their second year of life will show deficits in imaginary play. Imaginary play is a complex behavior that involves a number of developmental milestones. When a child holds up an object to their ear and pretends that it's a phone, and most kids are able to do this long before they're able to say telephone. This involves being able to observe your parents speaking on the telephone as a common behavior, being able to understand that one object can stand for another, an ability to understand that a certain gesture, holding something to your ear, is a way to describe an object. Holding something to the ear means whatever I'm holding is a pretend telephone. But according to DSM-5, deficits in pretend play fall under this category. In somewhat older children will have difficulties with making friends and maintaining those relationships. They're often isolated at school. And young adults may have difficulty changing how they speak or how they act to match the situation. The term for this is pragmatic communication. Pragmatic communication means having skills to understand the situation and act and communicate appropriately. Essentially understanding different types of relationships. We're much more casual when we speak to our parents, and this way of relatedness would not be appropriate at a job interview, for example. Another example is some kids or adolescents or young adults with autism may be going down the street, being very sarcastic to strangers, something that they're able to do cognitively, but they're not understanding that sarcasm may not be appropriate in a social situation that involves a stranger rather than your friend or relative. Now let's talk a little bit about the second large category of symptoms called restricted or repetitive behaviors and interests. The first group is called stereotyped behaviors. Stereotyped behaviors are repetitive, somewhat odd, and non-functional movements. In young kids, it often presents as rocking their bodies or flapping their fingers or hands in a certain way. And I think children use this to soothe themselves. Somehow it makes them feel better, but it's clearly not related to any functional purpose. This is different from mannerisms, which is part of what a lot of normally developing children and adults will have. Things like rubbing your chin or touching your hair at a particular time, or even talking to yourself to a certain extent may be a mannerism, which is different from stereotyped behaviors seen in children with autism. Repetitive speech can be an example of stereotypies. So some kids have echolalia, which means that they repeat the last thing they heard, or they repeat something that they hear or thinking about. The next item is insistence on sameness. Children with autism will have difficulty transitioning routines. For example, going from breakfast to getting dressed to daycare. Older kids and young adolescents, young adults will have difficulties with changing schools, moving homes, going to camp. Adherence to certain rules very rigidly, or just generally rigid pattern of thinking, are other examples of this category of insistence on sameness. The next category is highly restricted interests. Children with autism often have a preoccupation where they can spend hours on a particular topic or a particular object at the expense of everything else, and trying to pull them away from it can cause a tantrum or some other distress in that toddler. Some children, some normally developing children may be interested in trains or subways. Children with autism take it to kind of the next level, and they will memorize timetables or memorize extensive subway maps. The last item here is increased or decreased sensory sensitivity. This involves symptoms where a child is particularly sensitive to certain sensation, certain fabric. They cannot wear silk, for example, or they are very sensitive to a very particular sound, and that can cause a tantrum, can cause them to get very scared. Other kids have an increased sensory need where they seek out a particular texture or particular feel, or they are really preoccupied with certain food or the way something feels. One example that illustrates several of these symptoms present in the same behavior is a child who, when he is playing with a car, instead of driving a car like this and pretending that it's kind of driving around and going zzzz, he kind of flips it upside down and spins the wheel and staring at it. So in that type of play, we see lack of imaginative play, which often falls under social communication category, as well as this preoccupation with movement, which would be an increase in a particular sensory need or experience. We mentioned language several times when discussing these symptoms, but the core abilities involved in language, ability to understand spoken speech, ability to use words and string sentences together, can be separate from the diagnosis of autism. And autism is often classified as autism with or without language delays. This distinction used to be the basis for Asperger's, for the term Asperger's disorder, where children who have some of these core autistic symptoms but have intact language were said to have Asperger's. Similarly, intellectual disability, or what used to be called mental retardation, may or may not coexist with autism. It's a separate type of neurodevelopmental disorder which involves difficulty with learning new concepts and organizing them to be able to retrieve them later and make generalizations. So again, autism can be with or without intellectual disability. A quick word on screening. Around the time the child is 1.5, pediatricians will use a standardized instrument. One example of it is called AMCHAT, and this is the form. It's a series of questions given to parents. This is available in the public domain. If you Google AMCHAT, you'll be able to get this form. The first question, for example, is, if you point at something across the room, does your child look at it? So if you recall, this is an example of joint attention. This is a screening instrument, it's not diagnostic. If the screening is positive, it's usually repeated sometime after child turns 2, and usually child is referred for more extensive and more comprehensive diagnostic evaluation. So this was a talk on signs and symptoms of autism, how they are organized to make the diagnosis, and we briefly talked about screening. If you have any questions, please leave them in the comments, and please subscribe. All the best.